Hello guys, hello good people. Welcome to my YouTube channel. If you're new here, my good name is Winning Sarah, and make sure you subscribe. And for the returning subscribers, thank you so much for your support guys. So in today's video, as you can see, the dressing, I'm going to be talking about different drugs used in theater. Of course, we all know there are many different types of drugs used in theater, very many different classes, but today I've only picked 20 specific drugs. I'm going to talk about them, their classes, and their uses. So stay tuned. So some of the different classes of drugs which are used in theater, there are antibiotics, analgesics, there are general anesthetics, there are local anesthetics, and many more. So the first drug we are going to be talking about is the obvious drug that you all know, PCM. PCM in full, it's called paracetamol. So paracetamol, it's a non-opioid analgesic. Its class is called non-opioid analgesic. Paracetamol, it's given intravenously and it's used for post-operative pain. After the operation, after the surgery, you can give paracetamol together with other different drugs. We also have a drug like diclofenac. It's a non-steroidal anti-inflammatory drug. In short, it's called an NSAID. It's also used to relieve pain after surgery, and it's used in combination with other drugs. We also have a drug like tramadol. Tramadol, it's a weak opioid. It's an analgesic, but it's a weak opioid. So it's used for moderate pain. You see, like PCM and diclofenac, they are used for mild pain. Then tramadol is used for moderate pain. So tramadol, it's a weak opioid and it's used to relieve pain after operation, post-operative pain. It's also used in combination with other drugs. Then we have a strong opioid called morphine. Who doesn't know morphine? Everyone knows morphine, and morphine is used to relieve severe pain. So after an operation, you can give morphine together with other drugs, of course, in combination with other drugs, and it's used to relieve pain. So we are done with pain relievers. We are done with analgesics. Now let's go to local anesthetic drugs used in theater. So we have lignocaine, we have trophentyle, we have bupivacaine, and many more. So these are local anesthetics. They are used to numb the skin and the tissues under the skin before surgery. And like lignocaine, it can be used for these minor surgeries, not even surgeries, like in labor ward when you give an episiotomy. For those who don't know an episiotomy is an incision at the walls, an incision in the perineum to increase, or rather to enlarge the just go and Google or what an episiotomy is. But yeah, so before give an episiotomy, we use lignocaine. And also when you want to suture the skin and the underlying tissues, we use lignocaine. So on to the next. So bupivacaine, apart from being a local anesthetic, it can also be used for spinal and epidural analgesia. So let's go to general anesthetics. On general anesthetics, we have halothane and isoflurane, and they are used as gases for general anesthesia. So maybe if an operation is to be done for the whole body, to numb the whole body, we use either isoflurane or halothane. So on to there is a drug called atrocurium. Atrocurium is a neuromuscular blocker. It's used to relax muscles during surgery, in surgeries that require muscle relaxation. Then we have neostigmine. Neostigmine is a drug that's used to reverse the effects of neuromuscular blockers. Like for example, atropine, it's used to relax muscles during anesthesia, during surgery. Then now neostigmine, it's used to reverse the effects of those muscle blockers. Then we also have antibiotics used during surgery or before or after surgery. So we have like metronidazole. Metronidazole is the other name of flagyl. We have a ceftriaxone. We have a tetracycline eye ointment. We have a chlorhexidine. Yeah, and many more. So for ceftriaxone and flagyl, they are used for prophylaxis. Prophylaxis means they are used before surgery to prevent a infection, to prevent a surgical site infection. But in other cases, the antibiotics are used to prevent bacterial infections. But in surgery or in theater, they are used to prevent surgical site infection. So before any surgery, one must be infused with normosaline with ceftriaxone. It's an antibiotic. It's used to prevent infections on the surgical site after surgery. So then you have tetracycline eye ointment. This one, for example, when a mother has undergone cesarean section, after cesarean section, so the tetracycline eye ointment, just from its name, it's applied on the conjunctiva of the eyes to the baby. The baby's eyes. On the baby's eyes, we apply tetracycline eye ointment. This is used to prevent infections, transmission of infections. For example, if the mother had gonorrhea, the child can get this disease called ophthalmia neonatorum. It's an eye infection. It's discharge from the eyes, and this is usually due to infection from the mother. If the mother had gonorrhea, yeah, and then she delivers a baby, and the baby is not the baby's eyes are not applied, yeah, with that tetracycline eye ointment, the baby is likely to get that ophthalmia neonatorum. And this tetracycline, it's given to all babies, whether the mother had gonorrhea or not, just for prophylaxis, just to prevent. Yeah, and then there is another antibiotic called chlorhexidine. It's also an ointment, and it's applied on the baby's umbilical cord to prevent infection. After birth, when the baby's umbilical cord has been shortened, the chlorhexidine ointment is applied on the baby's umbilical cord to prevent infection. And then we have a drug called propofol. Propofol, it's used to induce and maintain anesthesia, and it can also be used as a sedative. It can also be used to sedate patients with COVID-19 who require mechanical ventilation. Then we have a drug called ephedrine. So ephedrine is under a class called alpha agonist. It's used to treat hypotension in patients who have undergone anesthesia. For example, during surgery, when you have been given the drugs for anesthesia, you can get hypotension. Hypotension is when your blood pressure goes down, and down. So to treat that low blood pressure, one is given ephedrine, which will try to raise your blood pressure. Then there is atropine. Now atropine, it is used during surgery when a patient is under anesthesia and the heart rate, it's going down, bradycardia. Bradycardia is when it's a low heart rate. So when you are under anesthesia and your heart rate is going down, the drug that can be used to raise your heart rate, it's called atropine. So atropine is in the class of anticholinergics, and it can also be used to reduce secretions in the respiratory tract. It reduces saliva and fluids in the respiratory tract. Then the last drug on our list, we have tranexamic acid. So tranexamic acid, it is used to reduce blood loss during surgery. So during surgery, when the patient starts to bleed so much, too much of bleeding, excessive bleeding, they are given tranexamic acid. Tranexamic acid will help to reduce the bleeding. Yeah, so guys, that has been the topic for today. If you enjoyed this topic or if you learned something from this topic, these are the drugs used in theater, and I've not listed all of them. I've just listed a few of them. And if you feel like there are some drugs that I've left out, or there is something that I've not given the whole information, you can write there down below. You can write below on the comment section and say like, this drug is this way and this way and this way, or you have forgotten this drug, and so on and so forth. And guys, if you have not subscribed, make sure you hit that subscribe button. Let's hit 1,000 subscribers. So bye, that has been the topic for today, and we hope for more and more topics, yeah, on medicine and hospital things and all that. So bye.